Most
guys
of
are tired
the
of hearing my
patients
voice.
that you're dealing with, are they Medicare population?
Oh, absolutely, yeah.
So 65 and older.
Typical 65 and older, yeah.
How are they referred to Cardiac Vision? So how do you get an intake from a patient, and what's paying for the service? I think some people don't talk about how the money flows in this world. I think we should.
Right.
Is Medicare covering? Like, who wants
Yes.
to take that?
Well, Medicare covers it, and so or their managed care program or whatever insurance they have. We do work with most, if not all, insurances for what we do. So how it works is that in a perfect scenario, a patient comes in. If you have a proactive skilled nursing facility or a proactive assisted living, a new patient comes in, you can look on their 3008, which is like their admitting documentation to a skilled nursing facility, or a 1823, which is their admitting documentation for an ALF. They all have to have these documents, which give their entire healthcare history about where they came from and what their diagnoses are. And if you have a good admissions person or a good marketing move-in coordinator.
How many of those are there? The majority? Or
there's
not the
more
majority?
than you think.
Okay,
There's more than you think, but there are opportunities for success for sure in every industry.
Everything,
across the board. But if you have an active building who has who's looking at what you're going to do for that patient from the day they walk in the door, they may refer us right off the bat. It's like, hey, we have a patient coming in. They're moving in on a Monday. Dr. Zamora, when are you rounding? When can you come see this patient? Or maybe one of our nurse practitioners, hey, when are you coming in? I have a new consult for you. And so we see those patients as soon as they move in, because if they move into an ALF or they come admitted to a skilled, the earlier we see them in the skilled, the better. Because because we may only get 3 weeks to see them in that skilled building before they go home or they go to the ALF or they move out of the country or who knows where they go. So the earlier we get on, the more preventative care and more proactive care we can provide.